Welcome to Washington Unplugged. I'm CBSNews.com political reporter Stephanie Condon. Abortion rights opponents are holding their annual March for Life on the National Mall today, and they have reason to be optimistic about their agenda. Republicans in the House last week spoke out against taxpayer dollars going towards supporting abortion. Pennsylvania Congressman Joseph Pitts, chairman of the Health Subcommittee on the Energy and Commerce panel, is sponsor of the Protect Life Act, a bill that would restrict federal funding of any kind for abortions in any of the programs enacted in President Obama's healthcare reforms. He joins me now from Capitol Hill to further discuss his stance. Since your bill specifically addresses the Affordable Care Act, is that an acknowledgement on your part that Republicans won't be able to pass the repeal bill that in the Senate as the House did last week?
Well, there are always two prongs. One is the wholesale repeal, and we don't know what the Senate will do. There are 23 Democrat senators up for re-election in 2012, so they ignore this at their peril. So they may take up a wholesale repeal, but it is possible they will not. And if they don't, this is a partial repeal to do something the president said he is for with his executive order, and that is to ban government funding of abortions. Only we want to make it statutory. We want to make it permanent in language.
Now, Congressman, I know that one of the Republicans' main arguments against the new health care reforms and for a repeal has to do with the notion of consumer choice. I know that you actually wrote in an op-ed this week for the Daily Caller. You said Republicans want the engine of competition and patient choice to run our healthcare system. With that in mind, why start with a change to the new laws that would further limit choice?
Well, the individuals still have choice, only it would have to be done with their dollars, their own private dollars, not with taxpayer money. So we think there should be more competition in the public sector and in the private sector, but we don't favor using taxpayer funds to fund the abortion industry. Abortion is not health care, and if they want to purchase that private insurance coverage, they may. We specifically state that in the bill.
But sir, I believe many healthcare plans do cover abortion currently, so that would mean that any women who want to keep their plan intact as it stands and stay eligible for tax deductions and tax credits they may get now, they'd have to pay for that extra coverage. Is that not an intrusion of government into healthcare?
Well, the bill is certainly a massive intrusion of government into healthcare, because until this year, we have always passed the Hyde Amendment, not only for Labor H or Medicaid abortions, but for SCHIP, VA, Indian Health, Federal Employee Health Benefits. So we do not subsidize abortion now up until this time, until this bill. This new Obamacare bill would drastically alter the policy that we've had for 30 years. All we're saying is maintain that principle of Hyde Amendment, only rather than do it annually, let's put it permanently in our statute, codify it. Then there's no doubt.
And I know you mentioned, Congressman, that the president should theoretically support this since he signed that executive order. The number of pro-life congressmen in the House and Senate were boosted in 2010, as were pro-life politicians at the state level. Is this a prelude for more abortion legislation to come? Is this issue making a comeback?
Well, I've been involved in the pro-life movement for many years, and I think the momentum really is on the pro-life side. If you look at the hearts and minds of young people and people in the polls, this issue has consistently polled 60 to 70% against using taxpayer funds for abortion. So I think it's consistent with where the people are. When we offered this, the Stupak-Pitts language, as an amendment on the floor to the first health care bill, we won 240 to 194 to 1. So we got massive bipartisan support. 64 members on the other side of the aisle supported us, and every Republican except one who just voted present. And so we think that this will certainly pass. I'm hopeful the Senate will pass it, the President will sign it, and there may be other legislation that we move to address this issue as well, but this is the first one.
All right, and Congressman, I have to ask you about the State of the Union coming up tomorrow. What do you expect to hear the president say? What would you like him to say? And what's your take on this movement for Democrats and Republicans to sit together? Will you be joining the Democrats?
Yes, I will sit with the senior Democrat from Pennsylvania. Tim Holden and I plan to sit together on the floor. Our delegation, I think, is probably sitting together. It's symbolic, but even symbolism sends messages. I'm hopeful that the president will moderate to some extent and be more interested in working with us on controlling spending and providing an atmosphere in this country to create jobs. That's the #1 priority that we have, and I hope we can work with the president in that regard.
All right, well, thank you very much for joining us today.
You're welcome.